Good evening, good night, guys. Today in this video, we are going over a serious topic. And this topic may be sensitive for some people. If you want, you can click off this video. You don't have to watch it. But we're going to be covering over mental health. And why am I specifically making a video about this? Well, mental health is very important and it is very serious to go over. And without further ado, I wanted to talk to you guys about it. Mental health is your brain is a very important vital in your body that helps you regulate your emotions, your feelings, the way you feel, your digestive system, the way you develop, and it is a very important asset that you take care of your own brain when it comes to your emotions, when it comes to your feelings as well. Because if you don't, it'll lead to other problems such as depression. There's personality disorders, PTSD. There's a whole lot of other personality disorders that will mess your mind up and cause you to be suicidal, will cause you to be depressed, not feel well at all, and will cause you to be wanting to stay in your room, locked up in your room, and not do anything. Either increased appetite or lowered appetite. You're more prone to addictions, and it is not a very good thing. Mental health is very important, and I'll be honest with you. It is very important that you look after yourselves, look after your family, especially if you're a family that has suffered from a victim that decided to commit suicide. And sorry for your loss, but it's a sad world out there, and I really hope that everything's fine if you did lose a family member or a friend to suicide. I'm just saying this now because I have a friend. I'm myself, and I have a friend that has attempted suicide but did not succeed with it. I've even had a committed suicide attempt, but it did not succeed at all. And I'm saying this out of my own heart and out of my own grace that I want to help you guys out and cover this topic. But like I said, mental health will destroy you if you do not pay attention to it. Check up on your friends and family. Sometimes the ones that laugh the loudest tend to be the sad ones. Some of them that are quiet, I don't know, or hood up, head down, that always seem tired and unmotivated and unenergetic, and the ones that have messy rooms, check up on your family. Check up on your friends. If you see a stranger not feeling well, check up on them even. Because suicide is not no joke. Depression is not no joke. And if you do not find help, depression will literally destroy you. It will destroy you if you are not careful, because depression will take everything, including your life. It will. It'll destroy you until it wants to make you take your own life, which is the sad thing about suicide. It's a sad thing about this world because we suffer. A lot of people suffer and deal with bullies, harassers, cyberbullying, and a whole bunch of shit. And um and it's a terrible thing, terrible thing. I've read many cases, at least I read a little bit, a few during school about cyber crimes, such as cyberbullying that cause some people to even take their own life. I have watched a news story about a kid who took their own life over suicide, over comments like that, over mean and nasty comments about their looks, about their personality, and about the way they are, and about not having a girlfriend. It's just a terrible, terrible, terrible thing to do. And we as a society, I know this community ain't the greatest, but we as a community and we as a group should really try to check up on one another and try to turn this community into a better place and a better community overall. Um, I remember back when I was like 13, 14, I never talked to anybody. I had depression, but it was not diagnosed until I was 14 to 15 years old. And my way of coping was terrible. I fought people during my middle school years. During seventh grade, I got into 5 fights, let alone because I let people talk down on me, and I let them get to me, and I fought them over it. Of course, I'm not going to go in detail, but my way of coping was fighting. Then I remember one day, a year later, we reached towards 2024 when I was in 8th grade, when I was in track. I tried to choke myself out in a bathroom, but I got stopped. And I got help because someone ran in and saw I was trying to choke myself and take my own life. And I got help, and I found the help, and I got into therapy for a bit. Now, you may say don't trust therapists. I don't really trust them, but there was this one therapist that I really did trust for a while. Then he left. But the happiest of people, the most quiet, the most happiest of people, the ones with messy rooms, even the quiet ones in the room, they don't always seem like how they are. Okay. They might just be quiet for other reasons. They might be quiet because they've never had a reason to speak. They've never had a reason to talk. They've never had a reason because every single time they would try to talk about something, maybe with friends or maybe people would just ignore them. So please check up on your family and friends because suicide and depression and mental health is not a joke because it'll destroy your hygiene. It'll destroy your physical health, your mental health, your body. It'll cause aches and pains. It'll cause a lot of problems in your body and make it basically go into like a bit of a shutdown. Suicide is not no joke, and I hope you guys can reach out to someone that you care about, someone that you love, someone that you trust. And if you can't, then reach the suicide hotline 988 because they are trained professionals that handle cases like this, or even talk to your school counselor. Talk to someone because your life means a lot. You only get one chance at life. You only get one chance, one shot, and that's it. You have a chance of being born 1 in 300 million of a chance of being born. And that's a crazy amount to say. You've been brought into this world for a reason. You've been brought into this world for a reason. You gotta live it. You only live once. So don't take life too seriously and have fun. Get in a little bit of trouble. Go, you have many reasons to live, and I will name them. You get to watch the sunset, get to watch the sunrise, feel the nice warmth of a shower, feel the nice warmth of a bath, feel a nice warmth of a hot tub, get to eat ice cream, hang out with that one funny family member, hang out with that one funny friend, hang out with that friend that considers like that you consider like family. Wake up in a nice, comfortable bed. Wake up and get to breathe air and live in a nice, warm household. Wake up and live on the days of snowy days, make snow angels. Get to go sledding. You get to do something. And the reason why I say these reasons because maybe these are small reasons why people still choose to live. And just know that not everyone ends up listening and they end up taking their own life anyway. But you got to identify it early. You've got to identify what a person looks like before they commit suicide, and I want to go over that with you guys. Such as symptoms of early suicide would be like verbal cues that a person will talk about feeling hopeless, trapped, or they'll feel like a burden, or they'll even start expressing unbearable pain, saying that people would be better off without them. They would also have behavioral changes like such as withdrawing from family, giving away their favorite items, and putting affairs in order and also making a will. They will either act risky or reckless, by engaging in more dangerous behaviors and increasing their usage of alcohol or drugs. You may notice that their mood and emotions will shift, such as displaying extreme mood swings such as rage, anxiety, a sudden sense of calm, happiness after a period of depression, appearing numb or empty, or experiencing severe sadness or irritability. And there's one more symptom of suicide I wanted to talk about, which is physical and lifestyle indicators, which is significant changes in sleeping, increased eating, like I said earlier. They will neglect their personal appearance. Like, let's just say if it's someone that likes to brush their hair, they may not brush their hair anymore. They may not brush their teeth. They may have more physical complaints like headaches, stomach aches, and even sleeping. They may sleep more. They may sleep less. And now I want to cover over what are the statistics for people suicide. Since there's no statistics for suicide in 2026 yet, and we're going to go over last year's. In 2025, the suicide rate in the U.S. went from is projected at 14.1 deaths per 100,000 people, with approximately 49,100 total suicides. The overall rate remains stable at historical peaks, with firearms accounting for 55.4% of all suicide deaths. And this is the problem, people. We need to work together as a community, even as a society overall in general. I'm not just talking about this Friday community. But we've got to lower the rate of suicide, and we got to bring it down to at least zero, and show people why they should live, and show people why they're unique and why they should keep on living. That's what I think. I'll tell you another thing. What also saved me was Jesus. And I'm not going to really get religious on this channel or in this video, but what saved me was Jesus. I believe in God. He came to me at my lowest and raised me up. That's what's keeping me going, because of God, my family, and my friends. That is what's keeping me going. People may have their other reasons like alcohol, drugs, but please, like I said earlier in the video, please be aware of the symptoms of suicide, of early signs of them wanting to commit suicide. This isn't no joke, and people have suffered from this way long enough. And mainly for genders wise, males have a significant higher rate, 22.8 per 100,000, compared to females, which is 5.9 per 100,000. Men 75 plus have the highest rate of any age group. In general, men also get treated like garbage. In fact, I've read this article, and it was a woman pretending to be a male for a year, going underneath a different name and everything. And when she got done with her research evaluation, she committed suicide herself because how bad men get treated. If you're a woman watching this video, just know men go through shit too. They're not just machines that have to be there for you. They go through shit as well. And men, if you're watching this thinking that women are just too emotional, they may be going through things as well. Both sides go through things, and we need to help each other out as a Friday community, first of all. And second of all, as a whole society overall. This is not just Friday the 13th related. This is just whole wide worldly related. And if you have any friends that are suicidal, please have them contact 988 for the suicide helpline that will help them and get them into the hospital, not to treat them as crazy, but to get them to calm down and get them to a therapist or even to a counselor in that matter. My DMs are opened if you want to talk about anything about that. I'm here to help, and I want to see this community thrive as well, and I want to have people to be happy. That's what I want. I want people to be happy, and I want people to succeed in life. Everybody wants the end goal of graduating, having a girlfriend, starting a family, marrying, having kids, and just overall living life. This is what we want as a whole. I'm sure all of us would want to get married, have kids, have a family, live a perfect life, and just chill and relax. If you're going through stuff and you need to take a break, then take a break and hang out with family and friends. Do what makes you happy at the end of the day. Do what makes you happy at the end of the day. And that is all I've got to say. And I do appreciate you guys watching this video. Suicide is not no joke, and just remember that. I will leave the suicide hotline in my description. I will also leave my DMs in the description, and I'll also leave other resources you can use to reach out to others if they're not going through a good time, if they're going through a terrible time. Thank you for watching this video, and I'll see you guys in the next one.